Hello, excuse me. Hello, and welcome to this next panel. In this session, we will have a chance to discuss some of the implications and questions and comments that may arise from our research as part of the project. There are 5 researchers. Welcome, Josie and Moa, and perhaps can we highlight other people? Sabrina, great. Eleni, that's great. Thank you very much indeed. So this session is a chance for all of us to discuss and to engage with the audience about questions arising from our research. We put in a lot of work looking at many different aspects of the situation of people with deaf blindness, of human rights, access to support and devices and accessibility, and the regulation of technologies, as well as other issues. And we covered things very quickly before. So this is a chance really to discuss this in more detail. And hopefully some other people will be able to join us from the last session too, some of the policymakers. However, before I go much further, perhaps not to put you on the spot, but perhaps we could introduce Josie Smits from the Netherlands. Very pleased that you're here. Could you tell people a little bit about who you are and your interests, perhaps, so that people know a bit more about you? Thank you.
Thank you. I'm an independent researcher, policy analyst, and I specialize in research on disability. And I was very happy to join this research project.
Thank you. I hope you don't, is it okay also, Josie, to mention your work with Inclusion Europe?
Oh, yes. I've been a member of the board of Inclusion Europe, which is an organization for people with intellectual disabilities and families of people with intellectual disabilities. And they have members all over Europe, outside the European Union as well. I think in 47 European countries. I was Secretary General, but recently I've done my terms, so other people picked it up.
Great, thanks. Well, very pleased you're here. So we have all of the country researchers, and obviously we showed the presentations earlier, but there was no time really to answer question and answers. And so another complication, slight complication, is that in the panel just before this one, I got cut off and I can't really see all of the chat and the Q&As that came from the audience. And I'm thinking, my thoughts are, in terms of structuring the work, it would be really good to respond first to questions from the audience to make sure that we cover these and engage with what people want to talk about. And then after, it's fine, we can, if we have time, we can talk some more about some aspects of our report that we didn't cover as yet. I'm just reminding myself and everybody else, because I found myself speaking too fast, so to keep the pace slow for interpreters and make sure we don't talk too quickly. Just about the questions, I'm not sure. My colleague Ray was going to have a look at these. Are you there, Ray, or will Arthur do this? Okay.
I can do it. We have.
Okay. Yep.
I have one. We have one question from the last panel, but perhaps you can try to answer now.
Yes.
It's regarding supporting networks for example, countries in Africa. We have one participant from Zambia, Africa, and this person is asking, well, we have been talking about supporting networks present in your countries in Europe. How can you support the same initiatives and the deafblind community in Africa? Is there any support available?
This isn't something I can't answer this. Does anybody on the panel have information? I don't know if there are other people here from Africa. Perhaps you could make yourself known in the chat. Josie, perhaps you have something to chip in. Thank you.
Well, just because you mentioned my being a board member of Inclusion Europe, Inclusion Europe is founded and works such that it supports organizations in member countries in trying to set up support and exchange information on how to do it. A similar organization is Inclusion International, which works worldwide. So one way to address the question is, can you consider becoming a member of Inclusion Africa, it's probably called, but it's part of Inclusion International, and work from there.
Also to mention that many of the deaf-blind organizations, I think, are very international. So we have a very international group here from many countries. So do reach out to people. Yeah, it's very important. I see Ray is here. He just didn't unmute himself in time. So if that's okay, Ray, you were going to check on and find questions perhaps answered in the previous session. Could I ask people though to put them into keep putting them into the Q&A? We don't just want to talk more about our research. We would also like to hear from you. But do you have some questions, Ray?
So I think all the ones from the chat and the earlier session. Sorry, I'm trying to talk and scroll through the chat at the moment, but I think they've all been answered. They've all been moved over to the Q&A.
Okay.
So we'll keep our eyes out for any others that come across.
Okay, thank you. In which case, I suggest that what we do is we consider perhaps have a discussion about each of the sections of the of our report, which we really didn't have a chance to talk about as such earlier. There was a question I picked up actually, which is from the previous panel, from June Lowry Kingston, and it was about why are the figures different in the different countries? Is it because deafblindness is defined differently in our different countries, or is it counted differently? And I'm wondering if colleagues could say something about how that works. Would you mind? Who could?
It's Moa here. Who do you want? Who of us do you want to start?
Go ahead. A volunteer. You.
Yeah. You. I hope that you others will fill in. So I think it's a question about definition. In Sweden, we use the Nordic definition, which is a functional definition. So we don't have objective measures of who has deaf blindness in that sense. So that is one way, but I guess in the other countries you have other ways to define who has deaf blindness. So that is, and that is not restricted, I think, to the how it's done within healthcare systems or within rehabilitation setting. It's also a question within research. How do we define deafblindness? And different definitions are used, both objective measures, functional definitions, and so on. So, and you others feel free to fill in.
I would like to add something. In Germany, we have a legal definition of deafblindness since some years, but in terms of data collection, we have the problem that we have different numbers of deafblind people in Germany, and this is due to the fact that we don't have reliable data. So we try to give an assumption or to count the number of the group, but it's not 100% true. So we don't know the true number in Germany. I think that's a problem for Germany. And if we could try to compare with other countries, it's getting more and more difficult because for one country we don't have the true number.
Maybe I can add that in the Netherlands, we use our own definition. It's a functional medical definition. But we have researchers state that the number of people that is estimated to have deaf blindness as from birth can be very much underestimated because it's not really diagnosed. If children don't communicate, it might be attributed to intellectual disability or multiple disability or such a diagnosis. And there's no real accurate screening. And these children might be deafblind and won't be, well, if communication, it will be a self-fulfilling prophecy. If you can't communicate and if you don't address that problem, there will be an intellectual disability, of course, because children won't learn. And I'm sure that's the same in other countries as well.
I think, would it be unfair of me to ask Eleni to comment? I think the situation in Greece is, I'm not sure if people with deaf blindness are recognized.
No, there's no explicit official recognition if we talk about policy or if we kind of look at disability-related provisions frameworks. And I think this impacts a lot how how recognized this group is in more kind of general terms. What we kind of speaking also with one organization of deafblind people, there was a kind of a very low estimate. It was around kind of a few thousand, but their kind of sense was that this is a very low number in comparison to reality, and this is potentially explained that people may kind of tend to identify as primarily blind or as primarily deaf, because also the way disability provisions are also kind of structured and defined. So there's generally a lack of data on the different types of impairment and disability as a whole. We don't, there's no kind of systematic activity, even kind of looking at administrative data to look at the actual numbers of people who receive, let's say, different disability benefits. There is some data, but it's all kind of very internal and it's not kind of publicly available, and it seems it's not also kind of made practical use, to kind of fit into policy making. So there is generally a lack of data that is systematically collected and can tell us something about the situation.
Thank you, everybody. Yeah, it's difficult in all countries and at European level too. There are estimates. We guess and we make estimates of the numbers. There are these issues. We have a question in the Q&A, and I suggest we jump to this, which is an interesting one. It's like, and we can come back to the reports and discuss other aspects after that. But this says, as researchers of the SUITCEYES, did you develop a resource list of all the technology that is available for individuals with deaf blindness? If so, is it accessible? Now, Perhaps I'll answer from the point of view of the project first. We did in the early days, yes, and it wasn't developed by us, but with other colleagues. They looked at what else is available, is under development, and so on. It moves very quickly. So we soon found there were many other things coming into place. And I think perhaps I can ask for comments from others. I think, not to put too fine a point, I think where there was most information was in Germany, actually, but I don't know whether you would want to comment on what you found, Sabrina.
Yeah, in Germany there's a big list of technologies which can be used by deafblind people, and we have a collection of all these technologies in a separate website, so everyone who is affected can inform himself or herself via this tool. But the problem is that it's not so clear where to get the money to get these tools. So it's a little bit complicated in Germany. You don't have a special way or a certain way to get to these tools. It can be very complicated. You might go to different institutions in order to get the funding for these tools.
Thank you. Yes, I mean, access to information was a problem for I think in all of our countries, and how would you find out about new technology? That was so, but that you had more in Germany than others.
Yeah.
Do others want to comment on this?
Perhaps I can share that. I mean, when it comes to assistive technology that is provided by the state, is funded, it's very low tech. So it's and that was one of the kind of main issues addressed, that people with disabilities of different types of impairments has they can only access very basic technical aids, and there's no kind of assistive technology as such is not included in the provisions by the state. However, I think in Greece, one of the most prominent sectors where there is some, private initiative to inform about available new technologies is in the field of education. And I think this also kind of generally stands out as a body of knowledge that is more advanced in addressing the wider topic of disability and new technologies. So it is, but of course, there's, it's a matter of, kind of having access to these platforms. There are some, as I said, kind of private third sector platforms that inform anyone who is involved in special education and wants to learn about the different technologies and potential of technologies, but nothing structured and systematic by the state in terms of kind of a resource list.
Great, thank you. We have an addition from Jonathan. I don't know, Arthur, can we if Jonathan would like to speak, perhaps, and explain it, could we, if that's all right, Jonathan?
Oh, yes, hi. Hang on. I hope you can all hear and see me. So it was really just, sorry, this is jumping back 5 minutes or so in the conversation, but it was really about...
Oh, sorry.
Yeah, it was really just about early identification of deaf blindness, and around the Nordic definition, which the World Health Organization has adopted, and really in across Europe, we're faced with a situation because we don't have a pan-European clinical definition of deaf blindness. one of the issues is that if you took the same deafblind child and put them through every diagnostic test in every country in Europe, you'd come out with some wildly different diagnoses coming out of that. One of the issues around separating things like learning disability and autism from deafblindness in the early testing, early interventional testing, is to do with cognition. And there isn't really a standardized cognitive test in the world that doesn't rely on vision and hearing to pass. And that's one of our central issues at the moment in early diagnosis. So my comment was just to say that Annika Johannesson, Jude Nichols and Tries van Noonen from the Netherlands have been working on something called the Tactile Working Memory Scale, which is peer-reviewed and looks to measure cognitive prowess within the bodily tactile modality. And that might be something useful in terms of separating and saying, well, we can tell now that this isn't autism or it isn't learning disability, so it might well be deafblindness. So it's maybe a handy bit of work to look at, and we can find more about that on the Nordic Welfare Centre website. Thank you.
Great, yes, we got Nordic Cognition Network on tactile memory working scale. Thanks very much. Sabrina.
Yes, I want to get back to the technologies available and accessibility. In Germany, there are a lot of products or technologies developed which are still not on the market. So they could be very useful for people with deafblindness, but they're still in the development stage. And there are a lot of projects working on new facilities or new technologies, but they can't get into the market because it's a very small niche, and it's not very productive or it's not very it's not giving the producer a lot of money to call it like this, and that's why there's a problem that some technologies don't find the way to the market, and that's very sad. I would hope that this aspect can change in the near future, because technology is making a lot of, or the recent developments in technology are making a lot of features available and can be very useful for people with deafblindness. And I think we should engage in this aspect.
Yes, thanks. Important problem. Yes, definitely. Okay, so I'm wondering if it would be worth to, yes, Josie.
I think, well, in the Netherlands, there's a lot of money and resources available to pay for technology if it would exist people who are deafblind. But the thing is that you have to get to know what is available, and or better still, what you would be asked to develop. And I think there's a role there for people with deafblindness and their organizations. They should ask for helpful technology, and then it might be developed. So part of it is to empower the organizations of deafblind people themselves in order to make the demands.
Great, important point. Yes, Moa?
Yeah, I just want to connect to this part about information and knowing what devices or what technical aids are there, because one of the fundamental things when you have deafblindness is that you lack information and you don't know. Someone has to tell you what is there, and that could be professionals, or that could be in the social network, or of course some people can find out what devices are there or what aids are there, and but it's a question about getting to know what is there and is it useful for me. You need to test it maybe, and you need to try it out and see, is it working? Can I use this? Do I want it in another way? And also if you find, at least in Sweden, technical aids that are provided from rehabilitation settings or within healthcare are procured, and if you then have found a technical device that you might want and you go to your rehabilitation agent and say, okay, I would like this, but we don't have that in the assortment, could be the answer then. We have this and this device, okay, but yeah, maybe that's not what I want. And of course, there is a possibility to make individual adaptations to get a specific device, but that is not always the way it's done because of lack of resources or lack of knowledge and so on. So it's the basic is, how do I know what aids are there, and if I can use them, can I get them, or is it dependent on where I live, what facility I attend, or what the resources are where I live. And then of course, information has to come from somewhere. As I said in the beginning, it could be from the professionals or from the social networks, but then there is requirements that the professionals have the knowledge about new technology and new aids that are there. And we have seen from the Swedish Resource Center for Deafblindness that this is a struggle for professionals also to have knowledge about new technology, about new aids, and to keep up with the rapid development. So it's a lot of things that come in play here to make aids accessible for people with deafblindness. Yeah, maybe a long talk about something. But
no, thank you. It's a very important issue about how to actually get hold of technology. Hello, Linda Eriksson from has a question or comment and will join us. Thank you.
Hello, my name is Linda Eriksson and I am a colleague of Moa in Sweden, and I have deafblindness myself. I will talk later in the next session, but I would like to make a short comment. And there is one problem. You need to have a list of different technical aids, like Sabrina said earlier. And then the question is, who is responsible to make sure that that list is updated? Because the technical aids are so fast developed, and you need to update this list all the time. And that's something that we have discussed a lot here in Sweden. There has been, we would like to have that kind of list, but then there's always the problem of who will be responsible to update the list and make sure it's up to date. Thank you.
Great comment. Anybody like to reply? Or I can. Yes, Sabrina.
Yeah, in Germany we have an institute called German Economic Institute, and it's private. And this institute is doing this work. They're keeping these lists updated, and there are people who are working on this all over the year, and they are getting always the information about new technologies and keeping the databases updated. So this is one institute in Germany who is doing this work. I don't know who is funding this. Maybe it's also from the state, but I need to get this information. If you're interested, we can talk about this later on.
This sounds good. Yes. If you have a link, I don't know if you have it now, or maybe could get it at some point and put it in the chat so that we can follow it up. that would be great. Yes, but it does sound clearly it's something that needs to be done, and some resources need to be put to it, and the continuing resources. So perhaps that's something to flag up as important, kind of going forward for the future. Okay. I don't see any more questions, but we may have them that because I haven't been keeping an eye on all of the chat. I wonder if we have moved on actually to, I just see this one more message. No, we're up to date. Okay, thanks, Ray. So we've moved on to be thinking about access to devices from the initial point. And I'm just wondering, another aspect that we covered in our reports was about accessibility. And so accessibility here we're thinking about is about universal design. It's about making the environment accessible so that people need less, or potentially need less, personal devices, or are in a better environment for using them. One aspect we looked at was smart cities, and we didn't find that much consultation going on in the development of smart cities. But we looked at it more generally in a legal context. And I wonder if anyone perhaps would like to comment on your thoughts on accessibility. I would just say we have a lot of recent European directives. Thank you. Sabrina just posted the link to the Institute, and that we do have quite a lot of recent directives from the EU, particularly concerning digital accessibility. We also have a new Accessibility Act that will come into play in years going forward. There's quite a long period of time for the legislation to be transposed into law in countries. So unfortunately, the UK will not be part of this, but it's a very important piece of legislation concerned with making the environment accessible. And we have a lot of digital directives come into being. Please, Eleni.
Yeah, on the question of accessibility, and similarly, you know, the issue of kind of knowledge about what is available, what technology is available to address different support needs or communication needs, which are very diverse. I think I kind of tend to see those as, you know, the kind of the vectors for change. I think what we also, the perspective or the approach we took with this policy reports is that, you know, let's look at the wider picture and let's see what factors would facilitate this, you know, this journey from the development of technology down to kind of adoption and use. So what we were saying before is, you know, I personally wouldn't, let's say, I wasn't thinking about, you know, individuals accessing. I would kind of hope, or, you know, if I was a policymaker, I would kind of look at how we can, yeah, embed technology in social support system, how we can transform service provision with the capabilities of new technologies, how we can use technology to, you know, kind of have enhanced quality services that kind of empower users. Similarly, with accessibility of the physical or the digital environment, I think ideally, if you have a society or a certain setting context where all, you know, the different kind of goods and services are accessible, the different mainstream, you know, your websites, your streets, your public buildings, then you have, let's say, the grounds for going a step further and for technology developers coming in and kind of putting their sensors, you know, kind of embedding the technology into accessible environments. That's kind of how I view it. That, I mean, if you have a very low starting point, which is, for example, in many cities in Greece, it's really hard at this stage to see how this could work, because, you know, the level of accessibility of the physical environment is quite bad. So I cannot, you know, even if you have a project on smart cities, you can only go that far, because you need to improve your infrastructure to make sure you get the prerequisites before you start kind of adding and embedding technology. Perhaps technology or new technologies can be a driver for this change. There could be an opportunity, but you have to kind of see the whole picture. You need to have accessible environments at the most basic level, I think, until you start kind of putting more complex, more sophisticated technology.
Yeah. Yes, thank you. One of the issues that was highlighted, I think, in our research are differences too in, you know, the level of accessibility and the level of infrastructure, if you like, and resources in different countries too. And I know that in Greece, there are fewer resources. Sometimes the quality of accessibility cannot be very good either, or not be enough, if you like, from the point of view of users. So even if we have something that in theory makes it accessible, but it keeps breaking down, or it doesn't work well enough to be reliable in every day. So there is still quite a long way to go with this. Where are we? 30. Okay. I'm just thinking it might be also good to say something about the third aspect that we reported on, which is about regulation of new technologies, because this is very topical. I would say that we wrote our reports, it was over a year ago. This is a long time in the world of new technology, which is racing ahead very, very quickly. And I know that in the presentation I did earlier, I wasn't so much talking about our report, but about some current issues around the regulation of artificial intelligence that went beyond. So I would not expect, you know, thinking about our reports, for us to be able to say very much about this, and we're not experts in this, but it seems to me there are two aspects that we need to regulate uses of technology that discriminate or disadvantage disabled people as part of society, but also that people with deaf blindness and disabled people can be users of technology too, of new technologies such as artificial intelligence too, and that needs to be recognized. I'm wondering if, can I ask for comments from colleagues? I think all of us highlighted the importance of regulation in some form. Or comments from anybody else on this issue?
All I can say is that in the Netherlands, there is in policy it has been stated that the AI strategy is to ensure that artificial intelligence is deployed such that human rights are respected and defended, and that all citizens are included in the development. But it's very easy to write that down. The next thing is to actually do it, and we didn't find anything in that field, in that respect.
Yeah. Yes, I agree. I think perhaps it's for the future, really. I think rather than, you know, for the past. I mean, we were looking at what has been done, and I think quite a bit of that work is still to be completed. Yeah. Could I ask? Okay, finally, we've got another 40. What is it? 41. We've got just a few more minutes. Some final comments, perhaps, from colleagues on the panel. Anything we haven't covered that you would like to highlight? Yes, please, Sabrina.
Yes, for Germany, we could see in our report that there are a lot of awards and funding mechanisms. They take place in Germany, and they show that on different levels, policymakers and in the research sector, companies and so on, recognize the topic of digital technologies, and that it's an important topic for and an important opportunity for people with disabilities to participate in a greater extent. But the main problem that we see is that people with disabilities don't get involved in the design teams. So from the beginning, people with disabilities are not involved in designing these technologies. And I think this is a very important point to look at in the future. So we need this participatory approach when we are developing new technologies.
Absolutely, I see others nodding too. I think it's this again is another important one for the future, is thinking about setting up kind of design teams, particularly with that in mind. Yeah, thank you. Final comments from others?
I think for Greece, there have been some developments in the kind of late part of 2020, and we are just starting to see disability policy talking a bit more with digital governance kind of policies, and I think this is what is important. So far, at least from kind of monitoring policy over the last years in Greece, we see that disability tends to be kind of seen from a specific lens. It's a welfare issue only, or it's a So I think what is important is for disability to start being mainstreamed, and for policies and ministries to be talking to each other and see how they can kind of work together to make sure that, as I think Jonathan was saying earlier, you don't just have a board which is accessible in one kind of clinic of a hospital, but you actually make sure it's widely available. And I think it's just starting in Greece.
Absolutely, completely agree that the importance of working across that divide of digital and support systems. Yes.
Could I add just or to
yes,
comment? Because this raising awareness about, you were talking about, Eleni, about disabilities, but if we go to deafblindness, it's about raising awareness about deafblindness in society and what that means, and that it's something different than having a visual impairment or a hearing impairment. So it's something else, and that needs to be addressed to be able to make things accessible. What is it that is the core of deafblindness that needs to be addressed? how do we access information? How can we communicate? How can we move around in orientation and mobility? All the things that we talk about in the Nordic definition, for example, and in other definitions as well. So I think that is probably a common situation that we have in different countries, that we need to raise awareness. And this is one way to do it.
Great. Thank you very much. I see that unless there are any really important things, we are at the end of our time. So it's 1:45. Thank you very much, everyone. Been really interesting session, very unstructured, but good for that as well. So thank you very much, and thank you to the audience for your questions and comments, and look forward to seeing you in the next session in 15 minutes time. Okay, thank you.